In the United States suffer from some kind of vein problems, and Rosemary's found out about a fairly new FDA-approved treatment for spider veins. Hey, Rose.
Yes, it's only been a few months, and I've got Dr. Conti with me here. Take a look at this. This is the probe, and he says zap, 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 and it's easy as that. So he's going to get started on Braden here. We're talking specifically this morning about spider veins, and he says, in particular, look at how small those veins are. Those are extremely hard to get to, and this new technology allows that to happen while the doctor is doing that and showing us pretty much apparently how they just disappear right before your eyes. This is actually something that you can also do on your legs. It has replaced in many cases I think it's called sclerotherapy, the standard that has been going on for many, many years, and there's really no downtime. So again, you're watching him do this. Apparently, from what I'm told, it sort of feels like a rubber band sort of zapping you just a little bit, and we're showing Braden here, who I said, gosh, Braden, does that really bother you? I couldn't even see those veins. And he said, well, primarily it's the ones right on the top of his nose that if you get back in there, you can see those. I guess those are a little bit more noticeable, but it's the smaller ones that the doctor says up until now, the standard technique, the sclerotherapy, just can't get to these smaller veins. So again, we are here in Carmichael. This is new technology, at least for the United States. It has been in and around Europe for quite a while, but recently here in just the last few months. Do you see that? That's amazing.
Yeah, this has really revolutionized the treatment of facial spider veins. It's become the gold standard for treatment in Europe, and up until now there really hasn't been any effective treatment for spider veins on the face.
Braden, get this guy a mirror. Is there a similar area of your face that you've had this done before?
No, I've never tried it.
So this is your first time. What did it feel like?
You can barely feel it, maybe a needle.
Okay, well, wait until you see your nose. It literally has disappeared. Get this man a mirror, doctor. All right, I'm going to pull Melanie in here because Melanie has been to the doctor several times. She's had it done on her legs. She's done sclerotherapy, and now she also does this new, what's called, again, Veinwave. And the doctor is going to show us how exactly it happens. I'm going to actually point out something that's along maybe we don't need to. Maybe the doctor's getting ready to go.
Here, Rose,
but I want to show you sort of. Go ahead, Paul.
Can he explain how it works while he's doing it? What is actually transpiring? What are we watching?
Okay, good question. Doctor, while you're performing this, can you explain to us exactly how it works?
Sure. The device that you see over there shoots a burst of radiofrequency energy into the vein, and the collagen in the vein wall contracts and closes off the vein.
And when he showed me the little tip to this probe, I called it a needle, and he said, well, don't really call it a needle because I don't go into the skin. It's something that just sort of zaps it right on top, correct?
Correct.
Wow.
Okay, and I said, wow, I've got to do this for myself. I've got a few that I want to have zapped out, and so you come on in and see him. It is not covered by your insurance, and it's usually about $300 a session, but because it takes usually more than one session, he'll usually work it out and give you a decent rate. We're about out of time, so thank you so much, and I mean, this is definitely something worth noting. Again, if you have them, especially on your face, those real tiny spider veins that doctors haven't been able to get to just yet, you might want to check this out. It's called Veinwave.
Yeah, great. Thanks. For more information, by the way, you can contact Dr. Conti. Go to veincare.com. I'm sorry, it's advanceveincare.com. The phone number's there on the screen. And boy, good luck. That's fascinating and maybe a relief some folks have been looking for. Joe, you're